is Dave Miller with Security Health Plan. With me today is Amanda. She is in our Pharmacy Services Department. Amanda, why don't you tell us a little about what you do and who you are?
Good afternoon, Dave. Thanks so much for having me today. So my name is Amanda. I'm one of our clinical pharmacy specialists here at Security Health Plan, and I grew up in central Wisconsin, attended pharmacy school right here in Wisconsin at UW-Madison, and joined the security team in 2018. So I'm excited to be a part of the team and tell you more about why I'm here today.
Wonderful. We have a program that has a couple big words in it. I know what it is, you know what it is, but I'm sure our viewers are wondering exactly what it is. What exactly is medication therapy management?
So that's a good question. So medication therapy management, or what I like to call it in short, MTM, this is a free service offered to the majority of our Security Health Plan members that have a pharmacy benefit with us. So really it's a way to make sure that our members and our patients are safe and that they're on the most effective medicines possible. So these reviews, they're with a pharmacist over the phone. They take about 10 to 15 minutes. And really, the key thing, especially in today's world, it's safe. Members do this at their house. No need to travel in to the clinic. It's all over the telephone.
You mentioned that it's for members who have a pharmacy benefit, but there must be other reasons why a member would choose this. What kind of prerequisites are you looking for to find a member who might benefit from MTM?
Absolutely. So we're looking in general for folks who have more than three conditions. So that could be anywhere from asthma, maybe it's high blood pressure, high cholesterol. Usually a minimum of three conditions and at least 4 to 5 continual medicines that they're picking up every month from the pharmacy. So really our team, we're proactively reaching out to those folks each quarter and hoping to schedule a visit with them to check in to see how their meds are going.
So if you're a member, for instance, I'll just use myself as an example. I've had a heart condition. I'm on a couple of meds. I don't think I would hit your parameters, but I might be very interested in an appointment anyway, just to make sure. Can I call you to set something up?
Absolutely. So the service is open to anyone that would like to speak with a pharmacist, and we can be reached at the number 1-888-651-7543. You can call this number anytime, and one of our pharmacy technicians will get you a spot scheduled with one of our pharmacists.
We've talked about an MTM and what it is, but there are benefits to having this done on a periodic or annual basis. Maybe you can talk a little bit about those benefits.
Great. So many benefits. Really, we're hoping that each member can really be getting the most from their medications. We're looking at safety. Sometimes members can be on up to sometimes 20 medications at once. So we're looking at each of those individually, making sure that it's the right dose, that there's no significant interactions between the medicines. Really looking at the whole picture. Also hoping always and searching for ways to save members money. So if there's a lower cost alternative that we can help recommend to your doctor, we will certainly let you know. And then the third item we're always looking at is, many folks take extra over the counters and extra supplements. So we just want to make sure that those medications are all safe and working well together.
Well, let's talk a little bit about maybe an example, what someone who goes through a medication review and then you find something. How does that process work?
Absolutely. So if we would find any recommendations or have any tips, we've certainly let each of the patients know what we've found. The other option that we offer is we're able to reach out to their doctor for them. We've got some new software that we really like to use that helps us generate letters and send those over very quickly to providers. So I would say just about every patient we speak with would like their physician to have a copy of our recommendations. So we're happy to send those over, and we offer that service to everyone.
You know, sometimes people, especially coming out of the hospital or whatever, may not be 100% sure about what's happening, what their doctor told them to do. They forget, they lose track. Tell me how a medication, appointment can help them get more understanding of what they should be doing.
Absolutely. So we're happy to meet with patients, especially when they're just getting out of the hospital or transitioning from one care setting to the next. And what we do is a deep review to make sure that our members and patients have started on the right medicines that maybe were new since hospital discharge, and also looking at maybe ones that they were taking before that they should have stopped taking, and really looking at that full picture. So, we'll look into any follow-up visits coming up with their doctors that they need to for sure mark on their calendars, and we're just happy to help in any way we can, just to help patients and members get a better understanding of their medicines.
Well, this sounds like a great program for members of Security Health Plan. But why don't you go over that number once again, where people can call you or the pharmacy department if they would like to sign up for this. Obviously, we're going to reach out to those that we know have significant issues, but for other members, what is that number again?
That number is 1-888-651-7543.
All right. Well, thank you so much, Amanda, for all that great information today, and thank you for watching. Have a great rest of your day.
Thanks so much for having me.